Program ini juga didukung dengan program internasionalisasi untuk mewujudkan Fakultas Ilmu Kesehatan yang unggul.
Fakultas Ilmu Kesehatan Universitas Muhammadiyah Surabaya dilengkapi sarana prasarana sebagai penunjang kegiatan, terutama ruang laboratorium yang sesuai standar dan dibimbing oleh dosen yang berkompeten, agar mahasiswa tersebut terampil dan inovatif dalam mengembangkan potensi diri, sehingga mampu bersaing dalam dunia kerja.
Pada bulan Juli tahun 2018 kemarin, saya diberikan kesempatan untuk bisa belajar pada program Asia Samad Program yang diselenggarakan di Busan, Korea Selatan. Nah, ketika di Korea, saya tidak hanya belajar tentang ilmu analis kesehatan, tapi saya juga belajar tentang ilmu-ilmu yang lain, seperti ilmu keperawatan dan ilmu tentang komunikasi. Menurut saya, kota Busan ini adalah kota yang sangat cocok untuk belajar karena memang di sana suasananya juga sangat mendukung bagi para pelajar, dan saya sangat senang sekali bisa diberikan kesempatan untuk belajar di Busan, Korea Selatan.
FIK UM Surabaya keren.
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 FIK UM Surabaya keren.
Menjadi bagian dari Surabaya, salah satu kota metropolitan. UM Surabaya terus melaju dan berpacu untuk memberi kontribusi dari berbagai bidang dan ruang. Melalui karya dan inovasi, serta
Beliau sudah ada. Bisa Bapak? Hello, good afternoon. Can you hear me?
Okay, good afternoon. Ajan
Mantana, yes. Mantana.
Montana. How are you?
Yes.
How are you?
How are you?
I'm good.
Are you all right?
Pardon?
Are you all right?
Yes.
Yes. Good, good. We are all right in Thailand.
Okay.
Okay.
What time in Thailand now?
It 12:30, 33 minutes past afternoon in the afternoon.
Oh,
Is
quite
that the
same.
same time?
Yes. Quite
Okay, good.
time.
So we will start at
1 p.m.
1 p.m.
Yes.
Okay, good.
Maybe 30 minutes more.
Mr. Mundakir, yeah, I think you should take off the mask. We can hear you better.
Yeah, because
You look much better out of mask.
like this. Okay. because many people here.
Okay, I see.
So I have to secure with others. Ajan Montana.
Yes.
How about your PowerPoint? Will you share by yourself or you need help from us to us? Screen share your PowerPoint. Will you share by yourself or you need help?
For my slide,
Yes.
yeah, I sent to the Yosinta.
Oh, Juanita.
I think he got.
Okay. Juanita will serve you.
So Yosinta will control the slideshow. Is that right?
Okay.
I have 18 slides. It not. I think it can cover for 20 minutes.
Okay.
Okay.
Hello, Miss Budi Rismiwati.
Hello, how are you, Mr. Mundakir? I call you Mr. now. You used to be my my junior.
Yes.
He was my junior at the nursing school.
Yeah. You are my sister, big sister. Okay.
It's okay. Your position now is higher than mine.
Oh.
You did good. You did good.
Still, but you abroad far from here.
Yeah, I tried.
Miss Budi.
Yes.
Are you still? Do you still remember in bahasa?
Yeah, either way. But I can present in English or Indonesian. It's fine.
Okay.
But I think it's better if I present it in Indonesian, so Miss Montana could also understand as well. Do you speak Indonesian, Miss Montana?
No, from Thailand.
Oh yeah, of course.
I'm from Thailand. Then you're from which institute? I'm sorry. I think I haven't met you before, right? Have you been to Thailand before?
No, I graduated from the same nursing school as Mr. Mundakir. I graduated from the same university, but I migrated to the United States back in 2000. So I've been here in the United States now for a while, and I'm working in a private healthcare facility since 2003 until recent. I've been working maybe 4 different facilities. It's a long-term care facility, like a skilled nursing facility. I don't know if there are a facility like that in Thailand. It's basically like another simple word is like a nursing home where we care for the elderly, but in here it's more focused on rehabilitation. So people who just released from the hospital, they normally stay in the hospital maybe for 1 week, and then they will stay in the skilled nursing facility for maybe a month or 2 months before they are ready to go home.
Interesting, yeah.
Yes. Yes, we don't really keep the sick people in the hospital here for too long. Normally the insurance cut their stay in the hospital, and then they will refer to the skilled nursing facility for rehab, for the physical therapy and occupational therapy until they are ready to go home.
Yeah, now Prof. Khadijah, have you joined us, Prof. Khadijah from University of Malaya?
Hi.
Hi.
Assalamualaikum.
Waalaikumsalam.
Yes, Assalamualaikum. How are you?
I'm good.
Good,
How about
good.
you? Yeah.
Excellent. I think we're starting only at your time 1 o'clock, right?
Yes. Maybe 25 more.
Okay. And I saw is it Prof from Thailand are here?
Yeah, I'm here right now. Yeah, I'm from Thailand.
Nice to meet you,
Nice
Sadadika.
to meet you. Good afternoon.
Afternoon. Is that correct, Sadatika?
Sawadika. Sawadika.
Sawadika. Yeah,
Yes.
that's right.
Yeah.
Yeah, yeah.
Exactly. Very
Yeah,
good.
and we have another, is it the other lady or gentleman? Who is in
lady, Budi Rizmi.
Buddhist?
Yes.
Dr.
Hello,
Buddhist.
Miss Khadijah. How are you?
Hi.
It's good morning in here. It's 2 in the morning right now.
Oh my goodness, poor you.
1:40 in the morning. I'm good,
Poor
thank you.
you. Nice to meet you. Nice to meet you. Where are you from?
I'm originally from Surabaya, Indonesia, from the same university as Mr. Mundakir is.
And then?
I am currently residing in Indianapolis, Indiana, United States.
All right, no wonder the time difference. Yeah,
Yeah.
it's like 12 hours time difference. That's why I was trying to figure out where you originally are. That's why.
Oh, okay.
Okay. So how is US? Is challenging?
Well, I like it's a little bit different in here now. In every case of death in the like long-term care facility, even though the cause of death originally is maybe a heart attack or other cause, but we have to report it as COVID. So that's why the number is higher.
Yeah, I think
I do not understand the idea behind it either. I think that's part of it. I'm sure it's political.
It must be very challenging for healthcare professionals there. Are you active in the hospital?
I work in a skilled nursing facility. So it's like a nursing home, but temporary, like for the people who come from the hospital who are trying to go home, but they were
right. So a stopover before they get discharged home. Yeah.
Like it's a rehab facility basically.
Yeah.
They come for physical therapy and occupational therapy and nursing part as well.
Yeah. So you do have a fair amount of very, what do you call it, population that is much affected by COVID, won't they? Because they are quite frail, won't they? Yeah.
Yes.
Yeah. Mostly elderly.
Yes, that's true.
Oh my
God. Even though like in some facility, like the place where I work, testing, but it's negative. But there are other places, like my husband is also a nurse manager at his facility. Testing, they do testing like once a week, and they will still find maybe 2 or 3 cases.
Oh my goodness.
And the next week test, everybody's negative. So
right.
It's yes. So we don't know the numbers from. I mean, might be another state.
Yeah, I think your US is so big, United States is so big, and each county have their own policies. So it is very hard to actually control it when it's so mixed, actually. Yeah, I can imagine. And I salute you working there because it is very traumatic also, I'm sure.
Thank you, thank you.
Yeah, especially you're facing them and you have to come back to your family.
Yes, thank God, Alhamdulillah, and my children, my husband so far were healthy.
Yeah, we have to keep our family safe, really, isn't it? And if children are get sick, it's always very worrying, actually. Yeah, very, very worrying. But great job you're doing there then. Yeah, must be, like I say, challenging and tiring too. Yeah. What about in Thailand? How is it going? I think Thailand are one of the few that also very good control, right?
Currently, we have just found a new case from the state quarantine, not just in the country. They just the people that coming back home, or some foreigners that
return.
Yeah, that's yeah.
So you're traveling, do you restrict a lot? Because for us, we are quite strict with the traveling.
For domestic, the government have released the section that people can travel.
All right, interstate.
Yeah.
Yeah, so they allowed that.
Yes.
But for coming back, you will have your quarantine policy in place, I gather.
These are the foreigners or from the people from outside the country, maybe from the neighborhood, because in Canterbury we have the border that near the Cambodia, and the people can come and go back and forth, but actually right now the government haven't let the people go across the country, but maybe they come illegally, but it's hard to control. Yeah.
Yeah, it's a big problem when your borders are connected to so many countries. So that is always difficult to control. I think like in India, big countries where there's so many county, it's actually very much difficult. Even in Malaysia, we are not so big like Indonesia, which is 10 times our size. We still find it quite difficult, and we have to put in police blocks to prevent people from traveling interstate at our peak time, really, because we find that there was cluster in certain county. So if they not control, then this cluster will actually spread through the other county. So we have our police actually was, alhamdulillah, like we said, was very involved and active in road blocking and very strict. So we actually turn back people, that try to travel, especially during festival time, because unfortunately, the last few months we got a few big festivals, and which people like to go back to their own family, their own village to celebrate. So that is where is educating them that it's more important to be saved than to celebrate with your family at this time and date, that sort of thing. So alhamdulillah, we have challenges, but it's the same like anybody, I presume. People perception is different. Yeah. But that is the issue lah, that we can learn from each other how each country actually do it. So thank you very much, the Universitas Mahadiyah. Right? Yeah, I think this is Mahadiyah. Yeah. That is actually very good that you convene this webinar, or you call it Zoominar.
Yeah,
Yeah, Zoominar. That's a new word.
I
Yeah.
think this is a part of realization our cooperation that Rector Muhammadiyah University has signed MOU between
Yes.
Muhammadiyah University and University of Malaya.
That's right. Yeah, we have some.
Now our rector, Mr. Dr. Sukadiono, has joined
All right.
us. Oh, still, yeah. Maybe Mr. Sukadiono can say hello with our speaker today. Oh, okay. Mr. Mr. Sukadiono still maybe still pray first.
Yes, yes. The prayers time actually. That's why just now I on it, but I was not. I lock in, but I mute, and my video was not there because I was doing something else. I thought better settle that than come back and join you all. Yeah, yeah, that's right. Yeah, maybe that's what he's doing now. Alhamdulillah. So how is the participation? I'm so sorry. Yeah, you are what is your name? You are Dr. Mudaki? No.
Yes.
Yes, you are, isn't it?
Yes.
I'm so forgetful. I was not sure.
You remember when we meet in Pajajaran in Bandung?
Yes.
Bandung.
Yes. Yes.
Remember?
Yes. That's why that was about a few years ago already, isn't it?
Yes. Yes.
Yeah. So I was not very sure. Anyway, nice to meet you again.
Thank you. Nice to meet you too.
And thank you so much for the invitation.
Yeah.
Yeah, that was a good job. You must work very hard for it then.
We just few. I think our prepare is very subtly.
I can imagine all the work. It's not easy.
Yes.
It's not easy to get everybody on the same time, same place, and then to arrange it as such. So well done to you and your team, really.
Yes.
That's
in
great.
Indonesia now, August or September is change curriculum or change like
Your
student
academic.
things
Oh,
there.
right. Okay. So that's why.
What we call it. Yeah, because we have to prepare everything to receive our new students.
Yes.
So many job on August or September is, I think,
A suitable time.
Yes.
So when is your new student coming in? Is it October?
September.
Oh, yours is September. Right. We used to be in September, but because of the MCO, we actually push it to October.
Oh.
Because our processes is not in place yet. And our student all cannot come to campus. Is your student returning to your campus? Balik tak bagi does your student return to the campus on the day the semester starts? Bila registration?
September.
They will come back to the university?
No. In this year, they're not yet to come.
Right. Yeah. Same here. Yeah. Yeah. So you register in September, but still go online.
Yes.
Yeah. We also have the same arrangement. We ask them to register, and then they can start their lecture online.
And my student maybe start in the new semester.
Yes.
For administration, keep up September, but maybe they come to campus maybe December. They will come here.
Yeah, very similar. We also our policy is no students until 31st December.
Oh yeah.
Yeah, after that they will do a review and see how we are doing, whether the curve is flattened or not. And then they'll decide whether we need to extend that or the student can come back.
Okay.
So what about your lecturers? Do they work from home, Dr.
Yeah,
Mutaki?
but we maybe every day there is one lecturer come just check everything, and then maybe 1 week only one time come to campus. 1 week or 2 week only one.
Your university is very kind to the staff. In University Malaya, we don't have students, but lecturer must come to the office
Oh, all lecturer.
every day
Oh,
since middle of June.
oh.
Oh,
I
goodness.
know. We do online still, but we do it from our office.
Hmm.
Yes. So you are very, very kind to your lecturer. They can work from home.
Yes.
Yeah.
Mostly we work from home because COVID still.
Yes. Yeah. Yeah. I think it's sensible because you less exposure, then better chance of not getting it. The more you're exposed to it, you never know. Nanti kena kan, nanti you get it because you're exposed to a potential positive. Yeah. So, but I think because Malaysia, Alhamdulillah, have dampened the curve a bit, so they feel that we can go back to the university. So all of us are back in the university Monday to Friday.
Yeah.
I know. But the private university, no. The private university actually let their lecturer work from home.
Oh.
Yeah, so only the public university, the government university, they want us to go back to work actually. So maybe it is just for, I presume they felt more confident with us in the university. Yeah. What about in Thailand? Do your lecturer work from home or in the university?
Right now we are full scale of working at the office. We just work from home for 2 months in April and May, and we start work in the school at the beginning of June. So right now the students come back and all faculty and staff are working in the office.
Oh, your students come back to the university already?
Yes.
All right, even for theory paper.
Right now we can teach in classroom, and they go to the student can practice in the hospital and in community like the regular schedule, but it just they have to keep the social distancing and normal lifestyles behavior, but for the arrangement for the academic issue, we do the regular schedule.
All right, good for you.
Yeah.
Because I mean, online is good, but there's a lot of interaction issues. So we wanted the student to come back, but our government policy is no student go back. So we're struggling it a bit and trying to get the interaction in place, basically. So we are worried about their soft skills, we are worried about their communication skills, because with online, it's so difficult to get them to be involved.
Yes.
That's our biggest issue, actually. Yeah. Do you teach a lot? What's your name? My God. Wait. I must get your name. Ada ke? Tak ada pun. Budi, is it? Yeah. Budi, is it? No.
My name is Budi, but I'm not a teacher. I work.
So Budi is a practitioner. But yeah. Do students come to your clinical area?
Sometimes, yes.
The posting. So can students now come to the clinical area for you all? Can they come to your organization now?
No. We were locked down for since the end of March all the way until the beginning of July, but mainly the one who come to visit the facility are family members. Family members of our residents or our patients. And even that one, we have to control them. They have to make appointments. They have to have reservation, and we are controlling how many number of visitor per day. So that way we don't overcrowd the facility.
Yeah. We also just started our students to go to the hospitals for their clinical posting, and they're very strict on the numbers. So each ward only about 5 can go in, and then there was strict procedures as usual about masks and PPE, and also about hand wash. So we have to go for a course and pass a course before we can go in. So the lecturer who also had to go through the course and pass it, get a certificate, then they will allow us to go to the ward. So they are still very strict, and I think that's good because because it is dangerous if the COVID actually and it spreads so fast really. So it is good that we put them in place actually. So all right, so your one also is very strict, yeah. I presume in Thailand also is the same, is that right? Your clinical posting.
Excuse me, Prof. Hadijah.
Yes.
Ajan Montana. Time so 1 p.m. here. So we have to begin the seminar. Maybe we will begin ceremonial this seminar.
Yeah, sure. Thank you so much.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good afternoon. First of all, let us praise and pray to the Almighty Allah Subhanahu wa Ta'ala. Because of His blessing, we are able to attend in this Zoominar with the healthy conditions. Secondly, praises and salutation, may peace be upon of our Prophet Muhammad Sallallahu Alaihi Wasallam, the last messenger who has guided us into the right way of life. We would like to give gratitude to the Honorables, the Excellency Prof. Hadijah from University of Malaya, Malaysia, the Excellency Ajan Dr. Montana Hemkayat, PhD RNs from Prapoklau Nursing College, Canterbury, Faculty of Nursing, Praboroma Chanok Institute, Ministry of Public Health, Thailand, the Excellency Miss Budi Rismiwati, LPN from Indianapolis, USA, and the Excellency Dr. Sukadiono, Dr. MM, as a Rector of Universitas Muhammadiyah Surabaya, the Excellency Dr. Mundakir, as Governors MCUP, as a Dean, Faculty of Health Sciences of Universitas Muhammadiyah Surabaya, and the Zoominar participant. So today's Zoominar, there was attendance, and in the registration, initial registration, there are 500 and more participants that will join in the Zoominar, and all of them come from Indonesia, some from Thailand, Malaysia, and also one from USA. On behalf of all committees, we would like to extend a very well welcome to all of attendants. Today, we are about to have an opening ceremony of the first international Zoominar with the title New Lifestyle as Solution to Success Coexistence with Coronavirus, that held by Faculty of Health Sciences, Universitas Muhammadiyah, Surabaya. Ladies and gentlemen, on this nice occasion, as a master of ceremony, allow me to read several sequences of the agenda in the Zoominar. The first agenda is singing the Indonesia Raya and Sang Surya. The second is opening remark. The third is academic and panel discussion. The fourth is giving certificate to the speaker. And the last is closing ceremony. So ladies and gentlemen, to take the advantages of the time, let's begin this opening ceremony. I would like to invite all of the Zoominar attendants to sing National Anthem Indonesia Raya and followed by Muhammadiyah Mars Sang Surya, which will be led by Master of Ceremony. So ladies and gentlemen, please rise up for the National Anthem.
Indonesia Raya, Indonesia tanah airku, tanah tumpah darah. Di sananya aku berdiri, jadi penduduk itu. Indonesia kebangsaanku, bangsa yang
tanahku, hiduplah negeriku, bangsaku, rakyatku, semuanya. Indonesia Raya.
Indonesia Raya, merdeka, merdeka, tanahku, negeriku yang ku cinta. Indonesia Raya, merdeka, merdeka, hiduplah Indonesia Raya. Indonesia Raya, merdeka, merdeka, tanahku, negeriku yang ku cinta. Indonesia Raya, merdeka, merdeka, hiduplah Indonesia Raya.
please take a seat. The next agenda is opening remarks. The opening remarks will be opened by Rector of Universitas Muhammadiyah Surabaya, and all at once to open the first international Zoominar entitled New Lifestyle as Solution to Success Coexistence with Coronavirus. Please welcome Mr. Dr. Sukadiono, Dr. MM. Time is yours.
Suaranya kecil ya, Mbak? Dengar suara saya ya? Halo? Suaranya kecil ya? Suara saya kecil ya?
Tidak, Pak. Dengar jelas sekali.
Ya, suara.
We can hear you clearly.
Monggo, Bapak, dipersilakan.
Oke, hello. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Peace be upon you and Allah mercy and blessing. The honorable speakers, Professor Khadijah from University of Malaya, Malaysia. Hello, good afternoon, Ms. Prof. Khadijah. Agent Dr. Montana Hemkayat PSC, registered nurse from Prapoklau Nursing College, Santa Puri Faculty of Nursing, Praburu Marjanok Institute, Ministry of Public Health Thailand, Ms. Budi Rismiwati, hello, LPN from Indianapolis, USA.
Assalamualaikum. Yes, thank you.
Assalamualaikum. Mr. Dr. Mudakir S. Nurse MCAP from Faculty of Health Science, Universitas Muhammadiyah, Surabaya. The committees and the Zoominar participants, good afternoon. Universitas Muhammadiyah Surabaya is one of the reputable universities in Indonesia, and we are strongly committed to significantly contribute to the development of education and health science globally by providing quality academic engagement. Right now, almost all of the countries in the world have been battling with coronavirus. Coronavirus in Indonesia has been widespread, fast, and massive, and it has an impact badly on all of the life sectors, including education, health, and economics. Our neighboring countries might have their own experience to deal with the impacts of this outbreak in the education and health sectors. Therefore, we provide this seminar as a media to exchange information related to lifestyle in preventing the transmission of COVID-19 and the implementation of teaching and learning activities in the pandemic era. The theme of this Zoominar is New Lifestyles as Solution to Success Coexistence with Coronavirus. This Zoominar is also a realization of cooperation between Universitas Muhammadiyah Surabaya with universities from abroad. I am, as a rector of Universitas Muhammadiyah Surabaya, strongly support this activity. And I hope in the future there will be other realization of cooperation in other activities such as research, collaboration, and lecturer or student exchange to support the development of education and health science. I believe that this seminar will have positive effect for academic lecturers, practitioners, nursing students, and the societies as well. I wish this seminar work smoothly and success. I mean, I want to apologize if there are words there that are inappropriate or impolite. Lastly, let's begin this seminar by saying Basmalah together. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much to Mr. Dr. Sukadiono, Dr. MM, for the speech. And next, we would like to invite all of the speaker, rector, the dean, and all of participants to take the pictures. And so please open your video in the Zoominar application. And we are going to take your picture part by part, starting from the first screen. Okay. Wait a moment, please.
Saya enggak ngantuk ya, Mbak ya? Capek jadi.
Sudah? Okay. Thank you for the speaker and the rector and also the deans. Wait, wait a moment. We retake the picture because we. Okay, I'm so sorry. Okay, so take a picture.
Bentar semomen.
Pisan, Kas.
Cek ganteng sih.
Okay, once more.
Oke.
Okay, thank you for the speaker, director, and also the dean and his staff. And the next. Okay, thank you very much. And before starting the academic and panel discussions, I would like to convey to the Zoominar participants in the Zoominar application and in the YouTube to make initial registrations. And we will share the screen about the rule of this Zoominar. We hope every participant have to follow the rules. Yeah, here is the initial registration link. So please, every participants to the initial registrations. Okay, and next about the rule of international Zoominar. Firstly, we have to sign in on time. And secondly, please use your surname for the ID screen so we can recognize. And do not close your session or log out during the seminar. Participants have to fill the initial registration in the evaluation form. Where is the data that used to be same? Because this information, the personal information, we will use to write in the certificate. And the fifth, turn on your webcam during the presentations. use the chat room only for a question during the presentation. So please, if every participant, either in the YouTube or in the Zoominar, if you have any question, please write down in the chat room and our moderator will read your question during panel discussion. Okay. Our next agenda will be handling by the moderator. And for today's Zoominar, our moderator is Ms. Aris Chandra Anandita, nurse MKEP, spesialis keperawatan anak. And right now, she is one of lecturer in the Faculty of Health Sciences, Universitas Muhammadiyah Surabaya. And also, her current position is the Secretary of Nursing Program. And her major research is in the ability children. So he already conduct a lot of research and also community services, and most of them about disability children. And some of her research and community services already published in the reputable journal. So I would like to invite her to come, and she will handle for the next agenda. Time is yours, Ms. Aris Chandra Anandita.
Bismillahirrahmanirrahim. Thank you, Mrs. Jua. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everybody. Yes, thank you very much for ladies and gentlemen still being here. Now let's continue for the plenary discussion in our Zoominar today. The plenary discussion will be delivered for speaker. And the first speaker is Professor Khatijah. She comes from University of Malaya, Malaysia. Professor Khatijah, let me read the curriculum vitae first. Professor Khatijah is a nursing professor at Department of Nursing Science, Faculty of Medicine, University of Malaya, Malaysia. She holds the post as head of department from 2008 till 2011 and from 2013 till 2018. Currently, she is the conduct coordinator for postgraduate studies by research. She teaches in both the undergraduate and postgraduate program at the Faculty of Medicine. She has also coordinated both the nursing undergraduate and postgraduate program. She is also an adjunct professor for Universitas Airlangga Surabaya and Universitas Pahlawan Tuanku Tambusai, Indonesia. Professor Khatijah's research interests focus on four major areas: women and child health, chronic disease management for patient and caregiver, professional development of the healthcare workforce, and nursing education. And the Professor Khatijah is currently the chief editor for the Malaya Journal of Qualitative Research, editorial board member for Pediatric and Neonatal Open Journal and Pediatric and Neonatal Open Journal. Okay, Professor Khatijah, can you hear me?
Yeah, thank you very much.
Assalamualaikum.
Waalaikumsalam and selamat petang. Good afternoon. Thank you for the kind introduction. So can I share screen to present, or how does it? How do you want it to go?
You want to share or we? Oh.
I can. Because if you, is this the one that I sent to you?
Yes.
But if you present, if you share, I cannot control it. Can I try to share first?
You want to share yourself?
Yes. Can you try? Close this. Yeah. Let me try and share. I share. Just give me a second. Oh, Where is it now? Okay, wait. Share. Right.
Okay, so already read.
Yeah, yeah, brilliant. So can everyone see it?
Yes.
Okay, so thank you very much. Assalamualaikum and selamat petang, good afternoon. And I would like to take this opportunity to congratulate Universitas Mahadiyah Surabaya for actually convening the first Zoominar for this very interesting conference seminar, and also to thank Director Dr. Sukadyano, and also the Dean of the Faculty, Dr. Mudaki, and of course, Yusnita and also Infan for actually liaising with me so that I can actually get this presentation in place. So thank you very much for the invitation. So for today, I would like to share with you how we sustain new normal in Malaysia. And basically, I'll be touching on the education and the service, right? So just a very brief introduction. Malaysia is very near Indonesia, and I'm actually a nurse and a midwife. And I did most of my education from the United Kingdom. And I have been actually working very closely with a lot of Indonesian universities because we have a lot of similarity in terms of some of our curriculum and also in terms of the cultures and our beliefs. So actually, we have very close MOUs with quite a fair number of universities. So thank you very much. So my outline for today will cover about 4 to 5 things. A brief overlook about what's happening in Malaysia. What are we doing in terms for education and nursing service? What are some of the challenges we ourselves face and some of the things that we actually put in place to address those challenges? I also like to emphasize that we believe in a manual. Policies are very important in actually handling the pandemic. And some food for thoughts, because basically, I think we have to really think about how we prepare our nurses, especially we are facing this pandemic, and there may be more in the future. So let's look at in Malaysia. Actually, our first case was in 25th January, and that was actually confirmed by 3 Chinese nationals. They actually came over to Malaysia from Singapore as tourists. And that time, even though Wuhan had reported in December their first case, we got it about a month later, I would say. And these are actually from travelers that come to visit us in Malaysia from coming through Singapore. Our first Malaysian case, a Malaysian which went to Singapore for a conference and came back as positive, was actually in 4th February. So at the moment, we do have about over nearly 10,000 cases, with 9,249 cases. And we're looking at our populations, which are about 24 million. So we are not that bad hit really, because 9,000 out of 24 billion is actually 0.0 something percent. However, we are very, very also keeping a monitoring so that it doesn't spike out. So we are trying to flatten the curve really. And we actually base it on these 3 considerations. And we consider that we want to, it's like a tap. We actually metaphor it as a tap. When to switch it on and when to switch it off. So when do we tighten the policies in terms of restriction is depending on the cases where we actually switch off the tap, we said. And when the situation is a bit better, we switch it on so that we give more movement, liberty of movement to our population. And of course, I think our government have really looked into is that we must think about the vulnerable group, the people who have morbidities. I think Ms. Moody also talked about her nursing home where they have people who have morbidities like diabetics and diseases. So we also balance it out, and also with the societal benefit. So for the good of the society. What are we supposed to do in terms of our restriction? So with that in mind, we have actually movement order, control order. We started at a very restricted movement in where we cannot travel interstate. There's roadblock. And when we go for any shopping for groceries, we actually restrict it to one person per family to go. Any and all the shops, all the supermarkets are open and the rest of the shops are all closed. So it's quite a lot of restrictions. Schools are closed, universities closed, parks are closed, cinemas are closed. The masjid, the surau are all closed. So we are encouraged to pray at home. Even though if it's Jum'at prayers, we also been restricted to pray at home. Now, because of the cases were slowly climbing up, we actually extended from 8th of March to 10th of May. That's nearly a good 2 months. We really restrict our movement. And that actually have an effect on the cases, and it actually become a conditional MCO where it's about 6 weeks where we can travel a bit more and more what you call it, some of the schools are some universities are actually opening certain limited courses where it's essentials. But the recovery MCO, which we are currently on, is where we can actually now allow interstate traveling. And that is important for Malaysia because we are very close knitted. So a lot of people miss going balik kampung, kita cakap, going back home to celebrate. Like we recently had the Al Muharram. So during that time, there was alhamdulillah, we get to actually travel back to all the states. In Malaysia, there's 13 states. However, if you fly to Sabah, Sarawak, which is also Malaysia, there is again quarantine. Those from Semenanjung, the mainland that goes to the Sabah, Sarawak, which is an island near Borneo, they will have to be quarantined for 7 days, even though they are Malaysian nationals. So in terms of that, is allowed, but we're still recovering from it. So there is still some restriction. The school is open, but as we just discussed initially, the universities are not open totally. And the schools opens with a lot of SOPs in place. So in terms of education, I'm taking University Malaya as an example, what we do during this COVID. We prepare it when in January, when they were saying that we already have this problem, we actually quickly do a survey on how the lecturer and students, are they ready to go online or not? And also we do a survey on the overview of internet access. So for those who have actually poor internet access, we actually let them stay in the university campus. And we actually, of course, we practice the social distancing. So those who have problem will stay back in our campus because the online courses will still continue. And then the decision was made that it has to be totally 100%, and our examinations is totally online examinations. So there is a lot of learning, steep learning for the lecturers and for the students to actually take on fully online. Even though in University Malaya, since 2016, we have started what we call a blended classes where we have online and face-to-face. But that was really blended. But now, because of this, it is 100%. So in terms of training and support, it has to be put in place. So support for students in terms of the internet access and support for lecturers on how to use the online technical things like the virtual things and or the platform. So in that case, it go hand in hand with online classes and preparation. So in a way that, I mean, I for one are not very IT savvy. So I know that has actually created a very steep learning curve for both of us. So other than this, after that, we have the adjustment on academic calendar. We actually try to extend semester break until we got all this policy in place, and then we start the online full swing. So there was a window for us to get everybody on the same page so that all the lecturers knows what they're supposed to do and how to do it. And the students also get preparation that if they cannot afford any internet, they have to inform us. So the window was very helpful for us to actually iron out any issue before we start the online classes. And we implement where the implementations come, and we know that we're going to have to continue until the end of this year, until the cases become more flattened. And also not only teaching and learning, but we also have to talk about assessment, because now we cannot actually have face-to-face assessment. So there's a lot of alternate assessment method built. How do we do OSCE online, the clinical evaluation? So these are the things that we actually put into the flexibility and how we're going to use it. And of course, the modification, some of the evaluation practices like having debates. Like one of the module, we encourage them to be more critical. So we have the debates team as an assessment. So in this case, we modified it into just presentation, because in debate is a bit more difficult to handle a lot of people speaking, presenting and debating. So we have to modify some of the evaluation practices and make arrangement for the clinical practices, the industrial training, looking into, of course, taking into consideration the government policies and also the organization's SOP. And we also open up for what we call incomplete grade. For certain things, we could not modify the evaluation practices. For example, the industrial training arrangement, where we do running assessment in the industrial, and we have problem with the SOP and policy of the organization. We actually then put an I incomplete grade, so that when the situation allows it, we're going to actually continue with that as one of the key assessments. So in a nutshell, we find it that it is actually quite difficult really to do a successful online learning, because a lot of things we have to strike a balance, especially on values, belief skills, interpersonal skills, leadership skills. Those are the things that we found is quite difficult to assess online. So those are the things that we are trying to work ourselves around it. And I hope during the discussion, maybe I also can learn from other organizations where maybe they have some solution for in calculating these skills into the online teaching and learning episodes. Now, for the service in nursing service in hospitals, actually our DG, Director General, Kansiri, Dr. Hisham, he actually felt that the 3 C's is the most important thing. So we have to address confined space, crowded space, and close contact. Because even if you wear masks, but you are in a closed environment, there's no 100% that you will not get it. So the social distancing is very important for us. So in all our classes, assessment, these are the government thing that, first of all, do we have physical space to ensure that they are at least 1 meter apart when we do any teaching or any assessment face to face. So of course, the hand washing is one of also the most important thing. And we have actually assessment for that, where students go through the the training, and they have to answer some tests. Then only they given a certificate to say that they have been trained to do it properly, and wearing masks and that sort of thing. So as you know, as Asian country, it's very important to be very courteous, to wish our patients and to welcome them when they need to come to the hospitals. So in a way, we also emphasize on non-contact greetings to all our clients, to all our patients, to say that we acknowledge them, but we cannot really contact in terms of the COVID. So the non-contact greetings is actually all taught and emphasized in all our hospitals, really. Of course, I think the most important thing and we found is that all of us are scared of it because we don't know what is happening. So we have a task force. So basically, with information, we felt that that could address any fear that people have. So if we look into some of the literature, I just pick up 2. And surprisingly, this one was actually in April 2020, which is about 4 months ago. It was actually published in International Journal of Nursing Studies, which is actually one of the tier 2 journals, actually, ISI. And they look at a systematic review. And I would like to share with you that their review is covering about 348 nurses, mostly qualitative studies, around 15 years. They look at all the published articles about it. And these articles cover from Hong Kong, Australia, UK, Singapore. So it's quite a wide range of reports they are actually giving. And they emphasize that in order to actually help people to reconcile and to be comfortable with working in pandemic situation, is we must have support. We must also realize that there is a lot of physical and emotional impact. That is not only just the scared, but also the physical emotional impact, and the organization must be responsive to it. So a hospital itself must take ownership and also covered all these concerns. So they actually, the paper conclude that nurses need to have clear, concise, current information, and they need to have sufficient access to appropriate PPE, which is a protective gear, in order to actually give high quality care to our patient. And of course, staffing is very important, how we actually put them into their shift work. We don't want to overwork them. And in terms of support, we have really to actually acknowledge that and actually put that in place. So in University Malaya Medical Center, we actually have resources like the psychiatric on call, the counseling services on call, and also we have what we call mentoring on in place for all the clinical areas, so that they can actually talk with these people. Now, the second paper I'd like to share with you was actually an online questionnaire from 2014 nurses from 2 hospitals in Wuhan, which is where the coronavirus started being detected. And it is confirmed that nurses will feel burnout, will have fear, will also have very high work burnout. So these are actually from an online questionnaire that was actually given to 2,000 our nurses who were at that time actively involved in COVID wards. So they are the one who experienced it, and these are the things. So in a nutshell, for our nursing services, we found that psychosocial and work issues is something that we should really address if we want to actually support our nurses who are actually working in the front line. And as our ICN, the Nurses Day, actually says that nurses, is leading the world. So we need to actually look after our nurses too. And sometimes wearing PPE itself, not only that is this actually very physically restrained and very, what should I say, very warm, especially in our country where we are very warm, very hot, I would say. So in addition to that, wearing a mask and wearing all the protective equipment will actually make things harder to work. I'm finishing, don't worry. And I got 15 minutes. Yeah. So there's a lot of things that we need to consider. So the last 2 slides, some of the solutions that we actually have implemented, like having teamwork, having shorter shift, and having dedicated wards. And for nursing educators, we have to make sure they are trained. Now, can life return to normal? I believe so, because I think we are very resilient. And this is not a life-ending pandemic. There is so many pandemics before that, like the SARS, the MRSA. So in a way, it will be continuing. But with a prepared healthcare system, we should be able to overcome it. We should be able to fight it. So the prevention menu, definitely hand hygiene, social distancing, border control, those are very important things that we have to bear in mind. And SOPs and communications, strict policies. So in summary, in a way, we must think about prioritizing health above economy. There should be excellent public communication, border controls if we need to, and behavioral change. And these are quite important things that we need to address really. So my last slide. On the other hand, are we preparing our students to handle pandemic events? In our curriculum, how much disaster planning do we put in? Should we reconsider doing it as a very important component now with these globalizations where diseases can actually just spread so easily within minutes? And what about the hospitals? Are we just actually prepared? And our public, the health literacy. So all these three are important things that we must consider when we think about that. So we are in it together. So, regardless whether you are in US or in Malaysia, or Indonesia, all of us are actually facing it. So we have to help one another and protect one another. So with this, thank you very much for your time. And terima kasih kepada Universitas kerana menjemput saya. Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh.
2:45.
All right. Thank you very much, Professor Khatijah, for sharing about very interesting topic, sustaining new normal in Malaysia. Excuse me, Professor Khatijah, can you stop share your?
Oh yes. I'm so sorry. I forgot. Just give me a second, yeah. Oh, wait. Stop sharing. Yes. Thank you so much. I forgot.
For your sharing. Okay. For the next speaker, our second speaker is Ajan Dr. Montana Hemkayat, PhD RN from Prapoklau Nursing College, Kantamburi, Faculty of Nursing, Praborom Chanok Institute, Ministry of Public Health, Thailand. Good afternoon, Ajan Montana. Okay, let me read the curriculum vitae of Ajan Montana first. Montana Hemkayat, Prapoklau Nursing College, Kantamburi, Thailand. Education experience. Graduate from Diploma in Nursing and Midwifery, Prapoklau Nursing College, Thailand in 1985. Master of Education from Chulalongkorn University, Thailand in 1991. Certificate of Neurological and Neurosurgical Nursing from the Neurology Institute of Thailand in 1995. Graduate Master of Science in Nursing from University Virginia, USA in 1999. And the last graduate PhD in Nursing from University of Virginia, USA in 2003. For the professional work experience is from 1985 until 2013, a lecturer and clinical instructor for undergraduate nursing student at Prapoklau Nursing College, Thailand. 2017 until present, the director of Prapoklau Nursing College, Thailand. And for the research interest, the elderly health and cities nursing education. Okay, good afternoon, Ajan Montana.
Yes, สวัสดีค่ะ
Sawadee-ka.
Selamat sore and good afternoon for all my dear speakers and participants in all countries.
Yes, thank you for joining us, Ajan Montana. Okay, now please, Ajan Montana, time is yours for 20 minutes ahead. Please.
Okay, thank you very much. If you don't mind, I would like to control the slide. Is that okay?
Oh, yes. We control the slide or you control?
If you don't mind, I would like to show my slide.
Yes.
So I can show. Okay.
Yes.
Okay, first of all, that I would like to thank to the Faculty of Health Science, Universitas Muhammadiyah Surabaya for having me as a speaker on the webinar in this afternoon. According to the new lifestyle of the staff and the student at Prabhupada Nursing College, Chanthaburi, Thailand. In short, I can call just PNC, stand for Prabhupada Nursing College, Chanthaburi. Is that okay? I would like to cover my hands-on experience that we deal with the COVID-19 situation in my college. And I would like to focus on the management that begin in the last week of the March 2020, when the outbreak was obvious in Thailand and the emergency decree was announced and enforced in Thailand. So here is the picture of our college. Chanthaburi province is located in southeast of Thailand, where we are in a kind of small town, but we have a lot of so many kind of fruits. And during the outbreak of the COVID-19, I mean in May and June, during this period, the products of several kind of fruit in the market. So it's kind of challenging for the province that to handle the situation. Let me talk about the background of the college. In 1965, the school was initially established in Prabhupada Hospital, Chanthaburi province, under jurisdiction of the Ministry of Public Health. And the school was under the patronage of Her Royal Highness, the Queen Lampai Pani, the Queen of the King Lama VII. Right now we have the King Lama X. The college is one of the 30 colleges of nursing under Prabhupada Chanok Institute, Ministry of Public Health. The college provides a 4-year Bachelor of Nursing Science program. We have about 600 students and 60 instructors and 60 support personnel. The college provides dormitory for all female students. So we have about 550 students. For about 50 of male students, they are living out of the dormitory of the college. The college provides short course training programs such as nursing specialty in nursing practitioner for primary medical care and for primary nurse practitioner. We also provide 1-year certificate for practical nurse. According to the new normal lifestyles at PNC, I would say it's based on the emergency decree of Thailand that we start this act on March 22nd or 23rd something, and we have relief sections. So based on the emergency decree, 3 phases of management for new normal lifestyle during COVID-19 situation at PNC were implemented as a follow. The first one, the first management before the college closure, it happened a few days before the lockdown in Thailand. And The second one is happened during the on-site college closure. So the manage implement during the lockdown, and reopening phase, the reopening of the college phase, that is the same time of the third relief section from sixth relief section of the country. Thailand has confirmed that from the 1st of July 2020, all existing COVID-19 lockdown measures were lifted. So it means right now the regular activity are coming back, but we still keep the practicing the new normal lifestyle. Let me go to the first phase of management at our college. This happened in the last week of March. We provide the information about disease situation and the policy of the government and the policy of the province to the students and to their parents by line application, and to the faculty and staff. So this is the management that we start. After that, we are cleaning up the all over the area in the building, out of the building, in dormitory, in the cafeteria, in the office, everywhere that people use the area. The picture show that this is in dormitory of the student, and they have to clean up all every area that they use. During the on-site college course, for the teacher, we prepare the teacher for teaching online, because in we have a very minimum experience about teaching online. So we have to, before teaching online, so we have to prepare the teacher and lecturer from that we invite them to teach online for the student. And for the student, during the course of the college, the students learned by online lecture and work on assignment from home for 2 months in April and May. The Student Affairs Division assessed the problems of the students happening during the learning at home, financial problems and their status, because something that we cannot imagine, that they are learning from home and in their hometown, what happened over there. So the Student Affairs Division access by using the Google form. And all academic advisors kept contact with their advisees by line application or maybe by telephone to make sure that all students were not in risky situation of the COVID-19 infection in their hometown. And for the staff, during the on-site course, the staff and instructors were allowed to work from home for a half of all their working hours, like they work every other weeks during April and May. Everyone was checked the body temperature every morning if they come to work in the college. The college set up new normal lifestyle following the policy of the governments and the policy of the province. The college closely monitored health problems of all staffs, because during April and May, there were a lot of cases affected by dengue fever and chikungunya virus disease in Chanthaburi. So that is make the case like worse because it's the early sign and symptom of virus infection they look like. And we go on to the opening the college. That means that at the beginning of the of June, the college start to open to quarantine the students for 14 days in the college before attending classes and participating or practicing in the hospitals and community. So we have to make sure that they are free from COVID-19 infection. The student will assess their history of health problems and traveling for 14 days before coming back to the college using application from of the Department of the Disease Control, Ministry of Public Health. If we found the student are risky because they got a high score, we have to separate them in other room, and then we can watch closely, and the student need to keep themselves in just that room. The student took part in making campaign and monitoring new normal behavior of their roommates, because if the teacher or the college just announce the regulation and ask the student to do so, but if they are living in the dormitory, we cannot get into every room of the students. So the student help a lot for this point. All students were swabbed to detect COVID-19 before going to practice. The next slide is about the student get the student was swabbed to detect COVID-19 before going to practice. So the hospital came to the college and do the swab for all students that going to practice in hospital and community. เดี๋ยวนะไม่ไปอ่ะมันถอยหลังอ่ะ and so right now we have the student all of the student come to the college, and they join the class and student activity, but every activity they have to check the body temperature, and they have to scrub their hands and keep social distancing as much as they can. So classroom and student activity reopen again. So right now we can do the regular schedule as we have done. For the outcome that we get from the hands-on experience in this situation, I think we made the goal that we can save the student and the faculty and the staff, that they can follow the guideline of the policy of the government, and all the student can pass requirements and the grade at the end of the school years. And right now we can start the new school year at the mid of the July. And the new normal lifestyle are adopted by all members of the college without forcing. And we also have lessons learned. I think we have learned that the pandemic and the disruption also has a potential to spark creative new ideas and partnerships to build more resilient education system for the future. And I think right now we still need to have the reliable information to be the prompt preparation. The new normal lifestyle are based on the universal precaution, which is still needed even post-COVID pandemic, because we don't know what maybe some kind of virus or some kind of disease, contagious disease coming back, and we have to deal with it. And I think this is something that that I have learned from the hands-on experience, is that the first century skills for nursing student, and maybe for all, maybe more than the focused 12 abilities that we have focused, but the resilient skills are also crucial to survive and to go for everyone and their country. So thank you for your attention, and if you have any question, I would like to take that after that. Thank you very much.
Anahim Chayat, PhD-RN, for very precious topic for sharing today. Yes. Okay, the third speaker is our beloved Dean, Mr. Dr. Mundakir Eskapnas MKep. Dr. Mundakir is born in Lamongan, 23 March 1975. Mr. Mundakir graduated from Universitas Airlangga in Bachelor Nursing in 2003, and then graduate for postgraduate in Universitas Indonesia in 2009, and for the doctoral program in Universitas Airlangga at 2017. And then Mr. Mundakir as a dean in Faculty of Health Science from 2017 until now. For the organization experience, he is the chairman of IPNEMA and active in Indonesia Association of Nursing, Indonesia Association of Nursing Education, Indonesia Association of Mental Health Nursing. And for the professional experience training, there are a lot of experience, and for the research is more than 10 experience in research that found by many sources, and for the publication is every years have a publication, I think. Okay, I would like to invite Dr. Mundakir and Eskapnas MKep. Please join with us. Your time is 20 minutes ahead. Time is yours.
Okay. Thank you, Bu Dita. Good afternoon, everyone. Before I begin, as a dean, I would like to thank to Professor Khatijah, Ajan Montana, PhD, and also Miss Budi Rismiati, my senior when we took nursing education in Muhammadiyah University, maybe 10 or 20 years ago. Yeah, 20 years ago. Thank you so much for your participation in the international seminar today. I realize we don't have a long time to prepare everything, but today we can conduct this international seminar. My topic today is nurses' experiences in new habit adaptation of COVID-19, which is about COVID-19 policies and practices in Indonesia and how nurses experience in dealing with a patient with COVID-19. Our outline, I will give you our outline, our presentation, firstly about overview, and then policies and practices from government. Thirdly, about nurses' experience. It is about our going qualitative study about nurses' experiences, followed by recommendation, and last, finally, is conclusion. Next. Okay, just summarize on December 2019, coronavirus disease broke out in Wuhan. We have officially declared that outbreak of COVID-19 as a public health emergency of international concern on January 30, 2020. And then March 2nd, 2020, in Indonesia, Indonesia found 2 cases COVID-19, the first cases. And then on April 23rd, WHO report, WHO reported that the number of COVID-19 cases reached 7,418 in Indonesia. And then July 10, 2020, there are shifting from new normal. Yeah, there is shifting from new normal to adapting the new habit. The term of new normal was suggested by President Jokowi in mid-May. And then the last present, the government has developed comprehensive recovery plan. For example, economic, health, education, and then the COVID-19 cases are still high, but mortality rate tend to decrease. Next. Okay, we can see the graph from the national government shows that the number of COVID cases is more likely to increase from March to August, reaching about around 143,000 cases on 80 August. Additionally, the report of Ministry of Health on 20 of August 2020 shows that nearly 150,000 patients are diagnosed as a positive COVID, and then 102 patients recover, 6,000 500 patients died of COVID-19 and 8,000 new patients are confirmed as suspected COVID-19. If we comparing about two reports show that the number of COVID cases increased for almost 6,000 cases in 3 days. It means cases COVID-19 still high in Indonesia. Next. Now, by looking at the distribution number of COVID-19 cases in Indonesia provinces, this show that the highest number of COVID-19 cases is DKI Jakarta province, and the second highest cases is Java, where the international Zoom seminar is conducted today. Next. Well, in this slide, I'm going to talk about COVID-19, especially in East Java. The number of COVID-19 cases increased until 61.45%, which is about 17,549 cases from mid-July to 551 cases in mid-August 2020. Next. This is about map. Indonesia government classify for zones to map the level of COVID transmission using 15 indicators consisting of epidemiology, health immunity, community surveillance, and healthcare surveillance indicator. Thus, for zone include green, it means there is no COVID-19 cases. Yellow, it means low risk. Orange, medium risk, and red zone. Red zone is it means high risk. About situation in East Java, briefly, East Java has 38 districts where the majority of districts are orange zone. Based on data on 18 August, 4 out of 38 regions have a red color zone, namely Sidoarjo, Kota and Kabupaten Blitar, and also Bondowoso. Unfortunately, on 19 August, Surabaya has changed from orange to red zone, but the update graph has not available yet. Next. This slide, I walk to about the government policies and how these policies influence the practices in dealing with COVID-19 in Indonesia. Up to March 2020, the government of Indonesia has established 15 policies and 6 document protocol, such as policies about regarding the guidance for the prevention and control of COVID-19, and then concerning of self-isolation protocol in handling COVID-19. Also, there are guidelines for mental health and psychosocial support in the COVID-19 pandemic, document protocol for health, for communication, for public transportation, and etc. Next. Actually, the government has implemented the policies into several activities or practices, including several hospitals. In East Java, I think government has 100 referral hospital. And then incentive, there is incentive program for healthcare professional who provide care for COVID-19 patient, rapid or PCR test for healthcare professional and communities. There is mobile COVID-19 testing, the alert village, or we call it Desa Siaga for COVID-19, and then giving punishment for people without wearing mask, reduction of the risk transmission like travel restriction, tourism, limit for public gathering, work from home, school from home, and also pray from home. And last, implementation of the social protection program like program Sembako, cash transfer, scholarship for students, many program from government, I think, has related. Next. Okay, ladies and gentlemen, earlier I talked that COVID-19 influenced all components, including nurses. In the healthcare setting, nurses are the largest group of health professionals, being the front line and interact to 24 hours directly with patients. Sadly, 600 nurses out of 90,000 health professionals died of COVID-19 internationally. Meanwhile, over 40 nurses and 80 doctors died of COVID-19 in Indonesia. Next. As I said before, pandemic COVID-19 influenced all components, including nurses. This brought us a particular study. Briefly, our study aim is to explore lived experience of nurses dealing with care provision for patient COVID-19. This study, we use a qualitative research as a research design. We interview 22 nurses using Google Form interview. In keeping with qualitative thematic analysis, the study constructed two themes. Theme one is holistic responses with 4 sub-themes, namely physical or bio responses, psychological responses, social and spiritual responses. And then the theme 2 is hope with 2 sub-themes. In this presentation, I only present theme 1. Yeah. Subtheme of the physical or bio responses found 3 categories. The first category is having low stamina. Few participants said, I'm feeling fatigue, dizziness, and chill spot while using hazmat and after treating the patient. The second category is skin problems. Few participants said that after walking, they feel itchy and often get acne or pimples on their face. The third category is low and or high body weight. Some participants said they felt body weight loss due to not eating while wearing hazmat. Meanwhile, some participants felt that they gained more weight because there were more food available in the hospital. Next. There are 4 categories for these subtypes. They include anxiety, empathy, caring, and being sensitive. Anxiety appear to most nurses because a lot of their colleagues got infected and died from the virus. Because the patient family are not allowed to accompany their family member, the feeling of empathy grow inside all nurses. While nurses are under duty and are not able to see their family often, they love their family grow bigger. One example is that nurses contact their family a lot more often. The pressure that nurses experiences can sometimes get to them, resulting in irritable environment. The subtype 3 is about social responses. There are 3 categories, including family relationship, social relationship, and protecting other. For family relationship, like increasing family attention, proud feeling from family, being homesick, and then social relationship, being isolated. Many nurses not going out from home, only stay at home when they are not going work. And then protecting others, stay at home and reducing social interaction. Next. Subtype 4, spiritual responses, consists of improving spiritual activities and being sincere as categories. Improving spiritual activities due to COVID-19, nurses increases their spiritual activities, such as pray, worship, and meditate in the course of taking care of the patient. Praying makes nurse more calm. Being sincere is which nurses feel sincere to the pandemic situation. They believe that COVID-19 pandemic is will of God, and they sincerely accept they bitterly. The presentation, this presentation recommend that the provision of care for COVID-19 need integrated health and social care. Strengthening coordination and partnership with communities, stakeholder and policymaker will support comprehensive care management in dealing COVID-19. To do so, the government, stakeholder, and health professional need strong commitment to implement effective COVID-19 program, followed by adequate continuity of monitoring of evaluation the program. In particular, COVID-19 has challenged nurses to enhance safety orientation in providing care nursing delivery, like using personal protective equipment, and then keep physical and social distancing, face mask, and hygiene frequently. And then be alert but stay calm and positive. Improve work-life balance, like stay healthy, stay rest, and etc. And also nurse need to increasing the use of digital technology or online services, like virtual health, virtual consultation, and etc. And the last, nurses need do regular screening for COVID-19 symptoms and testing as needed, because right now many symptom without symptom for the patient. And then the conclusion, my presentation is COVID-19 will test our ability to think, learn, adapt, and act as a global health workforce. And our success will depend on our solidarity within teams, communities, nation, and globally. Then second, obey health protocol to prevent COVID-19. I think this is not just for nurse, but all of us need to obey with health protocol. The need for community participant to combat the spread COVID-19, because I think we can depend only with government, but all of us need to need to participate to combat the spread COVID-19. I think enough, moderator. Thank you for joining us, for all participants.
Okay, thank you, Mr. Dr. Mundake. Very interesting presentation. We already hear sharing about how we face the pandemic in Malaysia, Thailand, and Indonesia. And now the last is sharing how to face in USA with our last speaker in Zoominar today, Ms. Budi Rismiwati, LPN, from Private Healthcare Institution, Indianapolis, USA. Ms. Budi Rismiwati have 6 years experience at Bridgewater Healthcare as a communicator in Indiana, with position as coordinator, assistant director of nursing. And then 11 years experience at Packworth Healthcare, Lebanon, Indiana. General manager at Panda Express, Indiana, 2013 until 2014. 1 year experience as assistant of international student counselor at Consulted University, Bakersfield, California. 1 year experience as a nurse at RSUD Bangkinang Riau, Indonesia. 6 months experience as a clinic nurse at PT Bayer Indonesia in Surabaya, Indonesia. Okay, good afternoon, Miss Budi.
Hello, good afternoon.
Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay, Miss Budi, please, time is yours for your next 20 minutes.
Yes. I would like to introduce myself a little bit. I graduated from the Faculty of Health Nursing of University of Muhammadiyah back in 1998. Back then it was Academy of Nursing. And then I migrated to United States in 2000. I came here to study computer science originally. And then after 3 years of learning computer science from Texas Tech University and California State University, Bakersfield, I decided to go back to nursing. So it was a long battle to get my my license transfer from Indonesia to here, and with the help of Mr. Aziz Alimul Hidayat, I was able to transfer my license, and I am able to practice nursing here in the United States. Of course, I have to pass the NCLEX board, State Board of Nursing, and I have been working as a nurse since 2014. But before that, I was a certified nurse assistant for 11 years. I am not representing a certain facility in here, but in my curriculum vitae, you see that was my experience. So I'm speaking now on behalf of that facility, but it's based on my experience and also from talking to another nurses and my husband as well. Also, he's a nurse manager at his facility. So I will share the experience with all of you. And I will start of what I have here. So this is the management of the COVID-19 patients and nursing role in skilled nursing facility and long-term care facility in USA during the pandemic 2020. For the managing patient in most facility, they do have designated zone. So we have a red zone, which is for the positive COVID-19, and yellow zone for the quarantine zone, and green zone for the negative COVID-19. This is for the red zone. For red zone, we normally have isolated with double door that separate this zone from other part of the facility building. And also it has designated nurses station. And inside this zone, the nurses and other staff must wear the PPE at all times. They also have a designated decontamination room with sink, shower, and toilet for staff, and designated exit door. So they cannot go back to other part of the building. They have to exit the building if they ever would like to exit the building, like at the end of their shift. And whatever enter the red zone must either be disposable or use a designated exit door. And we have yellow zone. In the yellow zone, the zone has a designated hall. It could be a part of a unit. So for example, the facility has 5 units, and the designated yellow zone, it does not have to be the whole 1 unit. So it could be just part of it. And not necessarily isolated with double doors. All the staff members must wear the PPE at all times inside this zone. Staff members are allowed to go to the green zone after sanitizing themselves, and also not necessarily has its own exit door. Now the green zone, in the green zone, the PPE usage is as necessary. Mainly, staff members have to wear masks. It could be surgical mask or the N95 mask. And it could be in the same unit as a yellow zone, but separate hall. Staff members of this zone are allowed to go to the yellow zone when assistance are needed only after a complete PPE are worn. Now the management of staff members. Each day, All staff members who are entering the building, they are screened for temperature and sign of symptom of COVID-19 upon entering the facility. The SARS-CoV-2 testing is priority for staff members who have signs and symptoms and be exempted from work until the test result negative and free of sign of symptom for at least 3 days naturally. Testing is recommended for the staff who has known or suspected exposure. If exposure is known without testing, the self-quarantine for 14 days is recommended. So that's, for example, if that certain individual is refusing or to test or thinking that the test might not be necessary, then they can be self-quarantined for 14 days. The CDC, which is the Central Disease Controller, recommended that the SARS-CoV-2 testing routinely is every 1 week in the skilled nursing facility and long-term care facility. Above are the recommendations from the CDC, but each healthcare facility has its own policy that regulate within the facility as long as following the main guidelines. Now, the State Health Department routinely come to check on healthcare facilities to ensure that facilities are following guidelines for infection control. Some facilities may not test the employee and patients weekly as per CDC recommendation. So some facilities might only test their employee and patient once a month. For the community interaction, this is during the pandemic. For example, with the hospital. Now, our facility, the skilled nursing facility or long-term care facility, a lot of time, of course, they are counting on their admission from the hospital. Admission from hospital, patient must have COVID screening and or test at the hospital before entering SNF LTC facility. Some facility may not accepting COVID positive patient depending if the facility has designated red zone. If the facility is not red zone ready, then they will not take COVID positive patient. Now, SNF and LTC facility will accept admission from hospital for COVID negative patients and place the new admitted patients in the yellow zone for quarantine and observation for 10 to 14 days. After this 10 and 14 days period, then they will move this new patient to a green zone where they will finish the rehab stay for another month or two, or they might end up living and staying at that facility for the rest of their life. Now, for sending patients to the hospital, SNF and LTC facility must give complete report to hospital ER regarding sign and symptom and reason why hospital reference as needed, and per provider or MD order, of course. And also must inform the last testing, if there was a testing. The same report must also be given to the ambulance or medical transport personnel. Interaction with other skilled nursing facility or long-term care facility. Some facilities that does not have a designated red zone usually will refer the COVID positive patient to another skilled nursing facility within the same company who are COVID ready. So for example, a lot of healthcare facility in America are belong to a certain corporation. And this corporation will have so many buildings. It could be in the same state or same city where I live. The company that I work have so many buildings in this state and another state. If one building does not have a designated red zone, once they find out a patient have positive test result, they would refer and send that patient to another facility within the same company. Now, for a referral to another skilled nursing facility, they are not within the same company. Usually, if patients are negative of COVID. Now, for interaction with patients' family members. During the lockdown from March till July, family members were prohibited to enter the facility. They may visit from outside the window and connect the audio through phone calls. The family members are also allowed to connect via video calls to a designated staff member, and the staff will go to the patient's room to let them connect. And this only if the patient does not have their own device, which a lot of the elderly, they don't really have their own smartphone or tablet. So we have to have an activity person perhaps that is in charge on connecting the patient with their family member. After the lockdown, the family members may visit after they are making reservation, and they may only visit in the designated visiting area. And only certain numbers visitors are allowed per day. All visitors must be screened for temperature, and they also must wear masks. The nursing role as a whole during this pandemic. We as a nurse, of course, this is our passion, and our job is to deliver patient care to the best of ability to preserve life and improving quality of life to our patients. And also as a health advocate to the patient who are under our direct care when the family members are not around and able to decide what care is needed. A lot of time, you know, the elderly, they cannot tell us what they feel, like their symptom, like if they are in pain or if they don't feel right. And we as a nurse, we have to be their health advocate and be more proactive to find out, like to discover what is our patient needed. As a bridge of communication between the patient and family members, since they are not able to see the family members as often as they used to, when before the lockdown, everybody were able to come and go to visit their loved ones. And in the beginning, it was so hard to do the lockdown. Family members were just so frustrated, and it was mainly it was family members who are frustrated about not seeing their family member who are in the facility. So we as a nurse, we have to also give some assurance and give them to calm them down and give assurance that we are going to take care of their loved ones, as they are our own family members, which also us as nurses are a secondary family to our patients, because they see us more often than they see their own family. Therefore, they will feel safe during this pandemic. Okay, and that's all from me. If you have any question, I would be gladly
Thank you very
to.
much, Ms. Budi Rismiwati. Very interesting sharing for the last presentation today. Okay, thank you very much for all of the speakers. Now we come to the discussion section. In the chat room of Zoom and YouTube, there are some questions that address to all of the speakers, but I'm sorry for not reading all of the question in this section, because so much question here and we have limited time. Okay, question for the first question is for Professor Khatijah. The question is, policy from Malaya University which can be used in clinical practice at hospital or community. Is there any policy?
Right. Thank you very much for those who asked the questions. For all our students that practice, we do have a policies in place. For example, first of all, they will have a screening to ask them whether they have been to overseas or they have been to gatherings where it is actually considered as cluster or hotspot. So we screen them with a history taking and of course the temperature. Following that, once we screen them verbally, we will then ask them to go through a course, which is actually like a short course about COVID, so that they understand the spread of COVID, how to prevent COVID, and the techniques to do it. And after they do that course, they will have to do an exam, which is actually an MCQ for them to test whether they really understand the severity of COVID and how to avoid it. So after the test, they have to score at least, they have the examinations or the MCQ test have about 20 questions. They must not have more than 2 wrong. And once, if they get 18 over 20, then they will be at least 18 over 20, they will be awarded a certificate. Now with that certificate, then only we actually send it to the hospital management to say that our students have done 1, 2, 3. That is basically the screening test, the screening as in the questionnaire, not the screening as in take swabs. All students did not have to take swab unless they actually declare that they have been to a gathering that is identified as a hotspot. Then we have to do the third one will be the screening where we take the swab, and they have to wait for the results to be negative before they can enter the clinical area. And as they enter the clinical area, we don't classify red zone or yellow zone like that just share with us. We actually classify as COVID ward or non-COVID ward. So we do not let the student go to the COVID ward because of the high risk, and they are students. So they go to a non-COVID ward. And just say in a non-COVID ward, one of the patient was actually detected as being positive after admission, right? So for whatever reason, the patient did not tell the whole truth. So later found out that she's actually COVID. That patient will be shifted to the COVID ward. The nurses who look after the patient will automatically be actually asked to do screening and be actually isolated. Isolated as in at their own house. They'll be sent back and not come back to work, advised to stay at their own home, right? With until the swab is actually negative. So if my student have that unfortunate to actually nurse a patient that later become positive, she will be taken out from the clinical area and be put back into the hostel and wait for the result. If the result come back too negative, then we will take her back to the clinical area, right? So our students also are restricted a number, so 5 in a ward. The ward is 1 floor, which is got about 56 beds. So only 5 to that ward. And the hostel for our students who stay in the hostels, also there'll be social distancing in the sense that they will not in the dormitories, they will be actually living alone rather than sharing the beds or sharing the dorm, like they say it. If they need to transport to community posting for the community health, the transportation also will have the same policy that in the van, we should not have more than, depending on the size of the van. So if to maintain that 1 meter, so if it's a small van, it should not carry more than 5 people. If it's a bigger van, then not more than 10 people. So it is actually put in place on how they actually put for the traveling, for the accommodation, for cases that is COVID, and all of them are given masks. The university will give them masks every day, 1 shift, because 4 hours they have 2 masks. So every 4 hours they're supposed to change their mask. So basically, an 8-hour shift they have 2 masks and sanitizer. So we'll give them a bottle of sanitizer so that when they're traveling, they have to sanitize their hands. In the ward, there is sanitizer, of course, but the mask and sanitizer, we automatically will give them every day as they come in after we screen. Of course, when they enter the ward, automatically they will be screened the temperature. So if they have a high temperature, if they have flu-like symptom, they'll be advised to go to see the staff health before they enter the hospital. And in the staff health, they'll decide whether to do a swab or not to do a swab. Because the swab, even the early swab results will take at least 12 hours the next day. So in a way, we do not just automatically do the swab just because they have flu-like symptoms. So the staff health will actually do a more detailed checkup to ensure whether to do a swab or not to do a swab. I hope that answer the participant.
Okay, thank you, Prof. Yeah. And the second,
Thank you.
thank you. The second question is from Mr. Asri for Ajahn Montana. I think it's already answered in the chat room, but could you be explain, Ajahn Montana, what is the contribution of community health volunteer in shaping the prevention and control of COVID-19 in Thailand?
Yes, thank you for the question. For the health volunteer, they are very helpful to control the COVID-19 situation in Thailand because they have like more than 1 million health volunteer in every village, and because they are the people in the community, so they know everyone in their community. So in the time that the crisis of situation, the health volunteer go to the house to check the health problem of the people in every household. So it they work closely with the health personnel in the village. So if the village have the case, I mean, for the people that worked from the area that have infected the COVID, like Phuket, and go back home, and the health volunteer and the health personnel in the community have to watch closely, and they work together. Is that make sense and answer that question? Because my team that already answered the question in the chat room as well.
Okay, thank you, Ajahn Montana. The third question is for Mr. Mundakir. How to improving motivate community participant to deal with the outbreak? Can you answer?
Okay, thank you for moderator. I think we have to remember about theory about motivation. Motivation influence for internal factor and external factor. I think in internal factor about knowledge, we can improve the knowledge community about COVID-19, about spirit virus, and how to prevent COVID-19. So we can improve their knowledge with education, or give them have health education. I think this is important because community doesn't obey if they have no knowledge about COVID-19. And then also we have to remember about external factor like a policy. Government have to implementation about a policy. Like I said before, giving punishment when community doesn't use a mask. I think the implement like that is very, very, very important and very effective to how to motivate community to obey the policy of government. I think like that.
Okay, thank you for the answer, Mr. Mundakir. Okay, the last question is for Miss Budi. Miss Budi, in USA, is there any traditional herbal or complementary therapy for coronavirus patient to enhance the immunity system? And is that law from the government?
Good question. American people, I don't think they believe in that. But as my own heritage, Indonesian, Asian, we believe in herbal. I have 3 plants of kunyit. What's kunyit? Turmeric and ginger plants in my backyard, and also the serai, lemongrass. So yeah, no, not for the common American people. If you see like on YouTube or social media, a lot of them doesn't even want to wear mask. So the government have to, or local government, each city might do it differently actually. Like in Indianapolis and the neighboring city now, at the end of July, after the lockdown, when people start going, out again to grocery shopping or wherever, some people didn't wear masks, and that's why the numbers spiked up in the beginning of July. It was crazy. So the implement of everybody must wear masks when they go to a public place, anywhere, the parks, the grocery shopping, and even when they implement that law, you know, some people still try to come into grocery store without wearing a mask, and they will call the police and create all kind of drama. But for herbal remedy, yeah, no.
Yeah.
Yes.
Is there any other question? But can we ask question? Can I ask question to Miss Khadija or Miss?
Yes. Oh, please. Professor Khadija.
Yeah, sure, Miss. Can you hear me?
Yeah.
Yes. Sure. Bu Budi. Sure, go ahead. If you can answer, why not? Yeah.
Yes, thank you so much for breaking down the of how the healthcare staff should do during overcoming the pandemic. You know, on your slideshow that we have to take breaks and everything. It's sometimes it is really hard to take a break. You know, do you perhaps have like certain like idea or suggestion on how we should do it, like how to better take care of ourselves as a nurse? You know, I mainly I'm just focusing on work. I don't know if that's kind of like also part of our culture, the way I see it. Asian are hard worker compared to, you know.
Yeah. Yeah, I totally agree with you. Our Asian culture is that we do not know how to take a break. So what happened is that in the ward, in the hospital ward, what we did was that we make sure that every few the nurses should not work non-stop with a break. So the ward sister will actually ask them to go for break regularly. Now, normal break is like tea break and lunch break, right? So for COVID ward, we make sure that everybody have at least every 2 hours or so, they at least go out in their rest room, take out their mask and rest for about 10 minutes before wearing back their mask and go back in. Especially those who are PPE. So we actually, the ward sister is the one that actually have to ensure that regular nurses go out. So in the morning, we have 4 people, usually in the ward of 28 up to 30 beds. That is our maximum capacity for each side ward. We have four staff in the morning. So they will take turns to go for their breaks. Their break cannot be long because obviously the coverage will be affected. So they actually give like 20 minutes break just to go out, take out and relax for a while and put back in. That was actually discussed with the staff nurses, the nurses themselves, how we can actually ensure that they have regular time off, really. A lot of us realize that wearing the PPE is no joke, especially if it's a full equipment, especially it's in COVID ward. It's worse. The normal ward, they only wear masks, right? But even with masks and in air conditioner conditions still, it's not comfortable, really, put it that way. So that's how we do it, is that to have more than 2 breaks. You know, initially, before COVID, 2 breaks, tea break and lunch break. That is a normal break. And we stressed to them that you have to look after yourself first before you can look after the patient. If you yourself is sick, then everybody will be quarantined, then we have problem with the patient. Nobody's going to look after the patient because everybody is being quarantined. So we get the pengarah, the director to be involved in this and make them agree that the nurses need time out. The same for the doctors, actually. It's not only the nurses. So in the clinic, especially, they have to open clinics because patients still have to come in, but the appointment, they spread it out. So instead of having 40, they put it down to 20. And what they did was that when it's too many and you cannot push back, they extend the hours, but they make it like a shift hours like that. So people who come after 5 to carry out the clinic until 9 would not come in the morning. So they don't stay the whole extended hours. And we don't encourage our nurses to do extended shift either because of this. Because if they are tired, they do not wash their hands properly, then that is actually affect the whole chain.
Yes.
Yes. So we try, the message come across that we have to take care of ourselves first before we can take care of others. It is not easy. Yes, I agree totally with you. Resources are limited. But it's actually trying to prioritize. So when we have not enough nurses, what we do is that we close wards. We close wards and transfer, because in Malaysia we have designated COVID hospitals, we call it, designated wards. So we liaise with other hospitals and say, and we transfer them out. I mean, it's better for them rather than we take the risk of nursing them when we ourselves are tired. Yeah, so we managed, it's not easy, yeah. I don't know whether that helps or not. It's a lot of, the hospital have to agree. And yeah, I mean, my hospital was one of the good ones that I actually followed. And it shows that our rate actually is one of the lowest too, because we really take precaution that much.
Yes.
Thank you for your questions. Yeah.
Thank you for the idea.
Miss Budi for the question. Okay, maybe this is the last question. This is important question, I think. So we decide to mention the question from Mr. Tuku Samsul Bahri from Faculty of Nursing Unsyah Aceh, Indonesia. According to 3 speakers, Professor Hatija, Ajan Montana, and Mr. Mundakir, how to prepare the student for practice in the hospital? Okay, maybe Ajan Montana first can answer.
Yeah, thank you. And I think for my hands-on experience that we have done in our college, we prepare the student before. I mean, before the college let them go back home, and we keep contact them all the time, and we need to know they have to be safe in their hometown and not go to somewhere that they are the place that is the risky place to get infection. And then after the school culture, when they come back to the college, we have to check and make sure that they didn't get the disease with them and bring the disease to the college. So we have to do the quarantine for 14 days. So we don't allow them to go anywhere, just in the college, even to the market. We need to feed them, and we need to, they have to use the, buy online or something that keep them for 14 days in the college. And during the quarantine, the student, each student got the toes swab to make sure that they don't have the disease. And because as we know that the young people, like the the student, they might have the virus without the symptoms, right? So we have to make sure that they don't have the virus in that throat or in the mouth or something. And that those were have done at on the day of 4th of the 5th day of quarantine, and then after that we do the quarantine until 14 days, and then we make sure that the negative result is reliable, because we still keep in mind that the negative result is not 100% sure for the free from the virus, right? So we have to make sure that before the student go to practice in the hospital and community. And I think it's fortunately for Thai people that we don't have new cases for quite a long time. I mean, in Canterbury, we have just only 3 cases around the end of March and the early of April. And after that, in Canterbury, we didn't find new cases. And for Thailand, I mean, for the overall of the country, we don't find new cases for like more than 2 months. So it kind of safe for the student to go to practice in the hospital, but the student are not allowed to take care of the patient that under investigate the COVID-19. So they just practice in the ward that believe that no case of COVID-19. I'm not quite sure, is that answer the question?
Yes, thank you so much, Ajan. Maybe Professor Khatijah, do you want to answer?
Right, thank you very much. I think we were not that strict like in Thailand, in the sense that we did not actually quarantine our students. What we did was that we make sure we actually make sure they understand, do the test, they understand COVID can be spread by all these means and we should do all these things. And then we trust them when we ask them for the health assessment questionnaire. So they're supposed to declare if they have any contact with a COVID positive person or if they have been to mass gathering. So we trust them that they will answer truthfully, and that if they say no, no, and then they go on and we screen their temperature and it was clear, and their answer that their knowledge is they understand the seriousness of COVID and the preventive measure, we actually let them go into the clinical area. Of course, during that time, we regularly emphasize on the importance of the hand washing. That is what we do for our students at the moment, and ensure that they maintain the social distance in terms of the accommodation, in terms of their transportation, and in terms of their location in the ward. So there was no swabbing and no quarantine when they come to us before we send them at the moment. Thank you.
Thank you, Professor Aditya. The last one, Mr. Mundakir.
Yeah, I just few adding from Professor Khadija and Ajan Montana. I think the first, we have to make sure that hospital is safe. Hospital is safe from student, and also the PPE is available for all staff, including student. I think this is very important because student when go to the hospital, they have to save. They have to save. And then second, we have to ask not only student but also student parents. If needed, we can ask parent a student to give like a profile form that they approve their kid or their student can study in a hospital, because like in Indonesia, hospital I think still high risk for the student. And then the last, I think we have to make sure that the learning outcome only if we send our student, we have to make sure that only in hospital the student can achieve their competency. So we have to re-examine, examine competency, learning outcome for student. Where is the skill competence, and then where is the we can achieve in our hospital. I think this is also important for us as a lecturer. I think that is my edit.
Okay, thank you, Mr. Mendakir. It's important to make sure all safe for student and hospital too. Okay, I will just say thank you for all speakers today. Thank you for the sharings and discussion today. Very interesting. And the next, I will read the conclusion of our discussion today. Nowadays, every country faces the same impact from coronavirus pandemic. Mostly, they follow the international guideline and they did adjustment according to their capacity. Okay, thank you very much for all of the audience and the speakers. And I will hand over to Miss Yuanita. Thank you.
Okay. Thank you very much. Deliver to all of the speaker for sharing the valuable knowledge, and also to the Miss Arishchandra Anandita for being a great moderator. So for the next agenda is giving the certificate to the all of speaker and also the moderator. So the first certificate will deliver to Professor Khatijah.
Kok Budi?
Okay, thank you, Professor.
Sorry. I hope you don't mind, but my name is Khati. Yeah, sorry. I'm so sorry. Yeah,
okay.
It's actually TI, not DI.
We will do the
Yeah, no problem. Thank you so much.
Thank you very much, Khatijah.
Thank you.
Tonight, the certificate will deliver to Ajan Montana.
Thank you very much.
Thank you very much, Ajan. And the next, the certificate will deliver to Bapak Mendakir.
Thank you so much for our colleague.
Thank you very much, Bapak. And the next, the certificate will deliver to Miss Budi.
Thank you.
Thank you very much, Miss Budi.
Thank you. My pleasure. It was actually an honor to speak with Miss Montana and Miss Khadijah and Mr. Mundakir. Such an honor. I get more knowledge from all of you who have more knowledge than me. Thank you.
Thank you very much. Your sharing knowledge is very valuable and give us a new view about how to handle and also about the zonation. Thank you very much, Ms. Budi. And the next certificate is delivered to our moderator, Ms. Aris Chandra Anandita. Thank you very much for being a great moderator.
Thank you very much for
Thank
Miss
you.
Iwanita.
Okay, and before we move to the closing ceremony, I would like to remind the Zoominar participants to fill the evaluation forms, and we already provide the evaluation form link in the share screen. So please, and I hope every participant fill the evaluation form. The data should be same with the previous in the initial registration, because we will write the personal data in the certificate. Okay, and finally, we get to the last session in this event. Thank you very much for every attendance. And I would like to invite all of the attendants to close this event, this Zoominar, by reciting Hamdalah together.
Alhamdulillahirrahmanirrahim.
As the master of ceremony, I would like to say best gratitude and also would like to say sincerely apology for any mistake in handling this Zoominar. Thank you very much for your attention. I hope all of participants will join with us in our next Zoominar. Thank you very much and see you next time. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Sawadika.
Thank you so much.
Thank you so much.
Bye.
Bye.
Selamat tidur dulu ya. Ini jam.
Maybe next year we can meet on the.
Inshallah. Inshallah. Yes, inshallah. Inshallah, you stay safe and have a great weekend.
Okay.
Nice meeting all of you. And assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh.
Acan Montana, Sawadika. Thank you.
Sawadika. Good luck. See you then.
See you then. Mbak Budi.
Mana Pak Aziz? Kok nggak ikutan?
Oh, Pak Aziz sibuk, masih sibuk Pak Aziz, mungkin sibuk. Oh, ada Bu Iva. Ada Bu Pipit juga, ini mana Bu Pipit? Ingat sama Bu Pipit.
Mbak Pipit. Iyalah, masa lali sama Mbak Pipit. Dibukalah itunya. Mbak Pipit. Ya Allah, masih di situ.
Nah.
Bud, ingat sama Anda, Bud.
Kenapa?
Apa itu Bu Iva? Keluarkan Van.
Iya, di sini jam 4.30 pagi.
Oh,
Kok nggak pernah nongol di Facebook?
Oh iya, Facebooknya.
Oh. Mbak Pipit masih di Universitas Muhammadiyah nggak? Kampusnya bagus sekali ya sekarang. Terakhir kemana?
Bagus.
Iya. Puncang, aduh. Kalau zamannya.
Nah, videonya dibuka, Bu. Mbak Rismi pengen ketemu katanya.
Salam.
Oh, mungkin lagi sibuk di sini sore.
Gak apa-apa. Mbak Iva di kampus apa di rumah?
Oh, Kak. Hah? Saya di kampus. Nggak bisa.
Di kampus. Hari Sabtu. Kalau libur hari Sunday aja ya? Kalau libur hari apa?
Sabtu Minggu.
Sekarang libur.
Oh, tapi datang. Terus ini rencananya mau Zoominar lagi kapan? Setahun sekali.
Nanti.
Enggak, gini, Mbak Budi nanti punya IG kan? Punya IG kan?
Enggak, aku punya WhatsApp. IG aku nggak punya. Punya sih tapi nggak pernah pakai. Mbak Pipit apa? Sama dengan Facebooknya?
Ini kita kan ada alumni menyapa gitu. Nanti mungkin bisa kalau pakai Zoom juga. Nanti ada alumni menyapa. Mungkin alumni bisa memberikan apa ya? Saling sharing gitu loh, saling sharing waktu pengalaman di sana gitu ya. Nanti tak undang ya.
Di Instagram. Ke Instagramku sama dengan Facebook kayaknya.
Mas Faiz ini, kamu ingat Mas Faiz enggak?
Iyalah si Faiz, teman kan satu angkatan.
Nah, iya.
Satu angkatan.
Pokoknya nanti kalau pulang Surabaya harus ke kampus.
Ya kemarin itu 8 tahun yang lalu aku mampir, tapi sampean nggak ada waktu itu. Adanya Mbak Pipit, Mbak Iva, sama Pak Aziz. Pak Mundakir nggak ada di kampus hari itu. Ingat nggak Mbak?
Ya Pak Mundakir masih di
Tahun berapa?
Tahun berapa? Aku kok lupa ya, Bud ya?
Tahun 2012. Bulan Mei lah. Akhir Mei aku mampir.
Ono lah aku.
Tapi kamu nggak ada hari itu. Adanya Pak Aziz, Mbak Iva, Mbak Pipit.
Sampai biyen niku pacaran karo sapa, Mbak ya?
Adike Mbak Pipit. Ya apa kabarnya Pujo? Anaknya 2. Anakku juga 2.
Terus sapa meneh kok nanti?
Siapa?
Erna, Mbak Erna.
Oh, nggak tahu aku. Aku seringnya kalau kontak-kontakan sama Samiatin, Dewi Mariam.
Maksum.
Nggak pernah aku dengar sama Cak Maksum.
Siapa yang sering kontak?
Ya Andri Novi sama Hasan.
Andri Novi sama Hasan itu masih di Ponorogo ya?
Iya.
Itu pasangan sehidup semati ya?
Di WhatsApp, biasanya di WhatsApp.
Sampai dia ini pacaran karo sapa ya?
Udah dibilangin adiknya Mbak Pipit.
Mbak Pipit? Mas Pujo?
Iya.